Have you ever wondered how a drug like chloroquine, commonly associated with treating malaria, actually works in your body? Well, fasten your seatbelts and prepare for a fascinating journey into the world of pharmaceuticals. Chloroquine, a well-known anti-malarial agent, has a generic name that is, quite simply, chloroquine. It's a name that resonates in the corridors of medical institutions and pharmacies worldwide, but its mechanism of action is what truly sets it apart. The magic of chloroquine begins at the cellular level. It operates by inhibiting the action of a chemical called heme, which is crucial for the survival of the parasites that cause malaria. When chloroquine enters the body, it travels to the parasite's food vacuole, where it prevents heme from being converted into a non-toxic form. This process causes a buildup of toxic heme within the parasite, eventually leading to its death. Quite a clever tactic, wouldn't you say? Now, onto the administration and doses of chloroquine. Typically, the adult dose for malaria prophylaxis is 500 milligrams of chloroquine once a week, starting 2 weeks before exposure and continuing for 8 weeks after leaving the malarial area. For treatment of acute malaria attacks, the dose is initially 1,000 milligrams, followed by 500 milligrams 6 to 8 hours later, and then 500 milligrams daily for the next 2 days. However, remember, all doses are subject to change based on the specific needs of the patient and should always be administered under the supervision of a healthcare professional. To summarize, chloroquine is a potent anti-malarial drug that functions by inhibiting the action of heme within the malaria parasite, leading to a toxic buildup and the eventual death of the parasite. It's administered orally, with doses varying based on the individual's needs and the specific purpose of treatment, whether for prophylaxis or acute attack. Keep in mind, however, that like any medication, chloroquine can have side effects. These may include nausea, vomiting, and abdominal cramps. Additionally, certain drug-drug interactions and drug-food interactions can occur. For instance, antacids or kaolin can reduce chloroquine absorption. Therefore, consult a healthcare professional before combining it with other drugs or certain foods. Lastly, always remember that while chloroquine is a powerful tool in the fight against malaria, it's not a one-size-fits-all solution. It should always be used under the guidance of a healthcare professional, with doses tailored to each individual's specific needs and circumstances. And there you have it. A brief but comprehensive look into the world of chloroquine. From its mechanism of action to its administration and potential interactions, it's a fascinating glimpse into the complex world of pharmaceuticals. So the next time you hear the word chloroquine, you'll know exactly what it's all about.